Well, welcome everybody. Again, I invite you to put your name and affiliation in the chat. Because we have a great deal going on today in our meeting, I'm going to hop right to it. Just to give you a quick overview, we are very lucky to have JanRose Ottaway Martin, who's going to give us an overview both of the North Sound BHASO and of the Opioid Abatement Council. And then we're going to talk a little bit with Kari Bray, who's here to show us everything that they've put together on our communications plan. And I'm looking forward to getting the feedback from you folks on posters, folks that we can get quotes on. She's got a really good setup going there. And then we'll get to our wins, needs, and insights. And I don't know if Amy Wheat is here, but I see Tracy is. I know some exciting stuff is going to be happening over at Darrington around naloxone. And then we'll do a quick wrap up with what our next steps are. We're definitely going to be talking about transportation and food for those community conversations and train the trainer events. So I'm very grateful you're all here. And I'm going to turn it over to JanRose. And I am happy to run slides for you, or you can do it yourself, whichever works.
I can go ahead and run slides. Let's see if I am actually able to share the right slides on the right screen. So give me a moment, everyone.
Okay, all right. So while she's doing that, oh, there we go. All right. We'll just let you tear away at it.
Perfect. And as I go along, I can't always see if someone raises a hand. So if there are questions during my presentation, please feel free to just kind of call out or break in. I don't mind interruptions. I am JanRose Ottaway Martin. I'm the Executive Director for North Sound Behavioral Health Administrative Services Organization. You will often hear us refer to as either North Sound BHASO, or North Sound ASO. We kind of go by all of those vernaculars, if you will. I do have a presentation. This one is relatively short, and the intent behind this one is to explain at a very high level what we do and what our body of work is. So thank you guys for inviting me today. And just to double check, you're seeing what you're supposed to see. Are you seeing the full screen of one slide?
We see both screens. We see your notes as well.
Okay, I don't mind if you see my notes. I'm not sure why it's only, okay, I'm not sure how to just show you one, so I apologize for that. If it's showing both right now. Let me try one more thing.
And also, you guys, I've put the link to today's meeting packet, which has all of JanRose's slides as well, if you want to look at them separately on your screen.
1 second. And do it a slightly different way to get the right view. Okay, now do you see the full screen?
Yeah, looks
Perfect.
great.
Awesome, thank you. So the first thing I'm going to call out, this is my name, just because I know it's a very long name, JanRose Ottaway Martin, so it comes up sometimes when people are emailing me. It's right on there, and I'll have my contact information at the very end of this presentation. Also, if people are interested, the structure of a behavioral health administrative services organization and how it sits within our structure of behavioral health is actually guided by legislators, and it was defined in this WAC. So this WAC is specifically to, at the highest level, what is a BHASO and what does it do in our state? And so I just put that in there for reference. So this screen is meant to explore and explain the entire continuum of behavioral health as it exists in our state. So this is across the entire behavioral health service continuum. When you look at this slide, and I think you can see my mouse, but as you look at this slide, you go anywhere from prevention all the way over to hospitalization. So at a very high level, the prevention level might be some outpatient behavioral health services. It could be the behavioral health crisis line, or 988, which is going to be the new kind of behavioral health crisis line, suicide intervention phone line in our state. Then into generalized outpatient substance use disorder and mental health treatment, that would be individual meetings with clinicians, such as therapy, case management, substance use assessment groups, et cetera. Detox for people who are dealing with substance use issues that require detox. Medication for opioid use disorder, that would be your buprenorphine or methadone, depending on kind of what you're using in the system, and providers that provide that on some regularity. residential substance use disorder and mental health treatment, so a facility-based level of intervention on behavioral health. Crisis services, in that realm, we're talking about mobile crisis teams, some co-responder units, some various groups that come out essentially when there is someone in the middle of a behavioral health crisis. Evaluation and treatment. This can look different, but in the SUD world, it might include a substance use assessment. On the behavioral health crisis side, it also can include designated crisis responders who either do an involuntary hospitalization due to substance use disorder issues or involuntary hospitalization due to mental health issues. And then at the furthest end of the spectrum is kind of the hospital. So this hospital setting is someone who's in an acute level of behavioral health crisis or symptoms and needs really intense intervention at a hospital level of intervention. Now, when you think about the behavioral health administrative services organizations in our state, and our BHASO is the BHASO for a 5-county region. So we serve Snohomish, Skagit, Whatcom Island, and San Juan counties. We have a very defined role within the system. So in general, where you see this arrow at the bottom, this managed care organizations and Medicaid, this whole realm from prevention all the way over to the edge of crisis on the Medicaid side of business is managed by managed care organizations. So insurance companies who are here in Washington state and manage Medicaid. We do touch that body of work, but on a much smaller level. And specifically, we have funds called non-Medicaid funds, which are dedicated to individuals who either don't have Medicaid and or for various reasons don't have access to Medicaid, such as immigrant and refugee populations. And we are able to finance this portion of the spectrum for people who fall within certain categories, prioritized populations, as well as under 225% of the poverty line. So, but that is a very small population in our region. So we have very little direct contracting for these bodies of work. What we do manage is essentially this line, crisis over to hospital. So what that means is in Washington state, we've identified that that body of work needs to operate kind of as a firehouse model, meaning that those services are ready and available regardless if a person is in a bed, that they're just kind of ready as the need is there. And we manage that side of the business. So contracts for designated crisis responders, the mobile crisis teams, anything having to do with kind of the ITA court structure or some of the court alternatives that are in place. We touch a lot of that body of work and oversee it and coordinate it in our region. Some of our services include designated crisis responders, as I called out. The HOST program, which is operational in Snohomish County, that's an outreach program for those with the highest acuity of behavioral health issues and often also experiencing being unhoused. Mobile crisis outreach teams, which go out when there is a situation that requires kind of someone else on site that's not necessarily a police officer, but also not necessarily requiring hospitalization. The regional crisis line or 988 coordination. So the regional crisis line is a number where people can call in regardless of what level of crisis they're experiencing and have a real person they can talk to. And in Washington state, we're in the process of actually converting over to a 988 model, which is essentially like a 911, but for behavioral health. It's just easier to remember. It's one that will coordinate more heavily throughout the state and also is funded by an additional tax revenue that hasn't been used before. Community Behavioral Health Rental Assistance Program. This is a federally funded program that helps support housing for a specific population of people, very limited in scope, but specifically those with some pretty significant behavioral health issues. The dedicated cannabis accounts, these are the accounts managed at the state level based on tax funding from cannabis sale, flow into our system, and then we contract it out within our system as well. We provide financial support of co-responder programs in our area. So where you have co-responders, essentially a mental health person who's responding with a police officer, we braid funding in for that body of work. We are overseeing assisted outpatient treatment, which is a new court diversion model. It's being piloted in Snohomish County actually to provide an alternative to hospitalization. The recovery navigator programs, which often act as like a case management entity for people who are struggling to manage the behavioral health system. We get all of the federal block grant funding for our region. Federal block grant funding is very specific and often has specialty program requirements such as opioid outreach, programs for pregnant and parenting women, et cetera. So we take in those funds and we contract them out to agencies within our region. We do regional coordination, not just of the crisis system, but are often involved in regional coordination of all behavioral health services in some way. We may not have the managing power at the table, but we're often the one bringing people together and problem solving issues that are found in the community. And we are currently the facilitators of the North Sound Opiate Abatement Council, which I'll talk about after this presentation, because I know there's specific questions about the opioid settlement money. In our region, we have two websites listed. So the one is just a generalized website for North Sound NS-BHASO. And then the secondary one is actually our supplemental provider service guide. This is a document that is actually our contract language to our agencies, but also includes program descriptions of all the programs that we're managing at any given time. So if anyone wanted to do a deep dive or understand more about what's offered in our region, that is a really good resource to kind of go in and just explore. Some pretty major basically issues or bodies of work we have on our horizon right now. We are one of two of the final regions moving forward with the Youth Navigator program. So much like the Navigator program I spoke about previously, this one is actually specific to youth and family. It only funds 2 to 3 positions in our region, so we will be keeping that in-house at the ASO to ensure that it's a regional resource, not one that maybe gets only utilized by 1 or 2 counties. Our hope with having this additional funding is we will have people on staff who can help people generally navigate what I think has become or is felt to be a very chaotic world of the youth and family systems, and try to help them get through that system in a way that's reasonable to families and individuals. So more to come on that. Our funding starts coming in July for this body of work, and we'll start to staff up and then bring more information forward. And I would love to be able to come to this table in the future. I see Lori nodding to actually do a program explanation and tell you guys what this will look like and how especially rural communities will be able to engage with it as well. Outpatient behavioral health services in rural communities is a priority issue. This is actually a longstanding issue across the state. In the work that led to integration, which is the managed care organizations taking over the funding for behavioral health as well as medical, I think what ended up happening is rural communities who already felt like maybe they didn't have as much behavioral health services as their urban counterparts, of course. It's being felt even more now than it was 5 years ago when integration happened. And I think unless we make this a concentrated priority for any of our region, it's one that is not going to be solved. The way that managed care organization funding works and how it flows to agencies creates a situation where agencies can't do the same kind of outreach that they were able to do even 6 or 7 years ago. And I think we're going to need to get creative to ensure that the rural communities are supported in new ways. The 988 Suicide and Crisis Hotline, this is a massive endeavor at all levels of the state. So the state government, DOH, Healthcare Authority, they're all highly involved. And then regionally, we're going to be working on dispatch protocols and regional coordination around this new hotline and how it will work and how it will dispatch behavioral health services. So huge body of work coming down the pipeline. Obviously, as you think of the I-5 corridor in our region, often we can support very well close to the I-5 corridor, but it's harder to get support out into the rural portions of community. There's new bodies of work, and this is actually the next bullet, around mobile crisis teams and how they will be contracted in the future that will hopefully allow us to broaden that approach and maybe make it more accessible to all areas of a county, not just that I-5 corridor. And then we're currently in the very early processes of writing our new strategic plan. So we are starting that work at various tables. We have our advisory board retreat the week after next, and the week after that, we have a board of directors retreat. And part of what I'm developing right now is a plan on how to bring that strategic plan out to partners within our community and get feedback. I've told my team that at the end of the day, it doesn't matter what motivates me. at the ASO and what kind of ideas I might come up with. It doesn't matter if the community doesn't have buy-in as well, because at the end of the day, we are managing public funds. We are public servants. That is our role at the ASO, and we need to meet what the regional needs are, not just what one person thinks would be interesting or seems like it would be a good idea. And then this is my email and phone number. Please feel free at any time if you guys have questions or want me to answer something regarding the behavioral health system. My background is actually heavily involved with all levels of that continuum, so I'm really well aware of services funded by the Medicaid world as well as those that we do at the BHASO. And I can be an asset in kind of answering some of those questions or developing ideas or problem solving at different tables. And I'm happy to be a part of that. Are there any questions?
Jan, this is Joe from Monroe School District.
Mhm.
In one of your beginning slides, you looked at the behavioral health continuum that North Sound facilitates. I'm wondering if you'd come back to that slide and let us know more about what prevention looks like in your world. Because in mine, you know, I received federal block grant funding for primary substance abuse prevention, but I think you are talking about a prevention that looks different than mine.
Yeah, so prevention, this is a very generic continuum of care that was developed. I think this slide was developed by the state some time ago, so it's one that we've all reutilized because it's been helpful. When I'm talking about prevention, it can be a lot of things. It can be utilizing an intervention early because maybe you're just starting to feel blue, so you're calling that VOA hotline, the behavioral health hotline, or in the future 988. Prevention could be early assessment or early identifying of needs, and sometimes that happens in our school districts, right?
Yep.
School district funding for guidance counselors or counselors in general varies hugely between school districts. So I can't really speak to Monroe versus like my San Juan County school district, for example. They've really different, I will say none are seemingly moving smoothly. Their struggles, but they're different struggles at each school district. But I actually think school counselors are a great example of a prevention that we don't have any funding or control over.
Got it.
I have seen situations where relationships are developed between a provider and a school district. You see this in King County, actually in Seattle, where a agency that primarily serves youth will make a contract with the school district, and they'll basically use the school district as a secondary office.
Yep.
And there's been some success with those types of models,
Yes.
but they also have been harder to maintain after integration, because prior to integration, there was additional funding that could supplement no shows or the travel time or transport. And in the new Medicaid world, that funding doesn't exist in the same way.
Thank you.
Randy, I see you have your hand up.
Yeah, I just want to talk a little bit more about prevention. So I'm the chair of the Snohomish County Mental Health Chemical Dependency Board. We have about a $28 million tax that comes in that we advise the council on and the executive. My big push since I've been chair is to put more money into prevention. We now have a new 1% of 1% for housing, and some of that will be spent on housing. It overlaps what our board has been spending. So I'm hoping that we currently we're putting out about $3.5 million into housing, and I'm hoping that this other tax will carry the ball on that housing, and our board can then spend more money on prevention, because I really think that's probably one of the biggest keys to get things back on track, is to be more focused on prevention instead of waiting till we have a problem and then trying to fix that problem.
Yeah, I 100% agree with you. I think behavioral health funding in general has been in a state of crisis the entirety of my time working in the field. It is only, I would say, in the last 4 to 5 years that we've seen significant state investment at that level. At the same time, we've seen additional counties move forward with this 0.1% of 1% sales tax initiative. A lot of those funds that are locally managed, so we don't, at the ASO manage those funds. Those are usually completely managed at a county level, is often dedicated to prevention. The other piece is with this map and how you look at it, you can actually move the prevention anywhere along this continuum, and I could make an argument for it, right? So often part of what my world is looking at is how do we move prevention closer to crisis and on the other side of crisis to ensure that someone doesn't cycle back through the system, right? And the prevention part, because we're so reactionary and we have had so low funding in behavioral health in general, I'm not talking about the BHASO specifically here, we've had to focus so much attention on creating beds and creating programs and trying to continue the very real issues we've seen in the workforce retention, and where we really then lack sources. And I think significant brainstorming is how much more can we activate this prevention section and where we plug it in throughout the system.
Good questions and thoughts. JanRose, I noticed you mentioned that there is an advisory board, and I know that this group is very interested in rural perspectives, and I'm wondering if you've got that on your advisory board.
I think that there is, I will be very honest. So I grew up in Snohomish County. My family's from Granite, actually Rogue Valley, up above Granite Falls in the Darrington area. I am a rural person at heart. I live in Everett now. What I would say is there's probably never enough rural perspectives. And there are consistently conversations. At the state level, our region is fascinating for many reasons, but one of those reasons is while we do have these urban hubs, right, of Everett, of Bellingham, a little bit Mount Vernon, but not nearly the same size as the Everett and Bellingham, we have massive swaths of rural that we cannot solve our behavioral health issue if we're not consistently and frequently putting that lens of how does this work in a rural environment onto our systems. Right now in particular, and Frontier actually, because when you look at Island and San Juan, it's even another level of out there beyond just kind of a rural east side of our counties, which is difficult enough. One example I will give you is historically the way we contract for mobile crisis teams is one team or one agency per county. And in the new world of what we're looking at, we're going to have to completely rethink how that contracting looks, honestly, because we have new mobile crisis team models coming down from the state. And we'll be able to hopefully create an even stronger network of mobile crisis, but that will include looking at our rural portions of our state and saying, clearly this model doesn't get out there in the way it needs to. So how do we reevaluate that and have mobile crisis teams more in the rural setting?
I think I, along with the folks at this table, really appreciate the knowing and insight that you're bringing to that conversation. And I want to encourage folks who are here who might be interested in serving on the advisory board to explore that further, because as JanRose says, we can never have enough of that perspective sitting at that table.
Yeah, and we can actually have a very robust advisory board, and we do have a very active advisory board right now. And I would say that having been at multiple entities throughout our state in behavioral health, this is the most I've ever seen an advisory board listened to, heard, and respected. And I say that with a lot of respect to advisory boards, but I think that what I've seen at some other entities is that you don't see the buy-in from management. And this has a long history, our advisory board, of actually impacting how we lay out programs or think through how we set up a system throughout our counties. So if you are looking to see if there's an advisory board where you feel like your voice should or could be heard, this is one place where that would happen. And we definitely have open seats, I think, for all 5 counties right now.
Great. Thank you. All right. Are there any other questions on this section of what JanRose is presenting? Okay.
And as I'm closing this and opening the Opioid Abatement Council, one thing I would also call out for context, because I didn't say it before, our board of directors is actually, not every BHASO has the same type of board of directors. For our board of directors, it's actually politicians from all 5 of our counties, which actually makes for really robust conversations and means that we're extremely braided into what's happening in each of the counties and the community so that we can actually be responsive and reactive to our region. And that's pretty amazing. I did work for King County for several years, and there was no board of directors over King County's ASO. So that complete engagement to the community is really a great feature here. So opioid abatement council. For those who don't know, and just to verify, you can see the big slide, right? Okay, thank you. The opioid settlement funds, the way that they were broken down, I think a lot of people heard, oh, there's all this money coming into the community and how hopeful we are that that can make an impact on the opioid epidemic that we are faced with in the US. The one caution I would give everyone is when you take those numbers and you break them down by the communities they go to, and then you break it down even further by the 17 years in which they will be paid out, it's maybe not as much money at one time as people kind of think when they hear some of these very large numbers that are happening. There are multiple links in this presentation. So as I go through, I'll try to identify what they will actually speak to. And I highly recommend, if you haven't taken a chance to go look at the One Washington Settlement Agreement that identifies how these funds will be utilized, that you do, because I think it's pretty informative, but also shows how much of the pie gets broken down among cities, counties, and the state. So the opioid abatement councils were set up per the One Washington Settlement Agreement in Washington State that guides the distribution of the funds from these settlement dollars. The idea is that there would be this oversight committee, if you will, that kind of sits over a region. The region had to identify an entity to hold the responsibility of facilitating that opioid abatement council. In our region, they then created this North Sound Regional Participating Local Governments and North Sound Behavioral Health Administrative Services Organization, MOU, that's what's referred to right here, and identified who would have membership in the local regional OAC. So while we are the facilitators of the OAC and have responsibility to the community they're in here in this document, we are also not the sole determiners of this body. And I think that's important to call out. We are partners with each of the 5 counties get a member, and then in each county, there are usually multiple cities or one city over the population of 10,000 that also get funding. They had to select one representative for each county for the cities in that county. So we are in the OAC, there's us and then 9 other official members when we're at full level of engagement. So the way that that breaks out is you have Snohomish cities, Skagit cities, Whatcom cities, Island County cities, and then San Juan County, because San Juan did not have any cities over 10,000 that received funding. For a little history, for those who you all probably know, but I always put this in here just in case, this is the link to the Washington State Settlement Agreement. The Attorney General, Bob Ferguson, worked with prosecuting attorneys throughout the state on an allocation agreement for those settlement dollars. This is referred to in general as the One Washington Memorandum of Understanding between Washington municipalities. And often you'll hear those of us who work with it a lot shorten it to One Washington Agreement. In total, 125 eligible local governments, counties, and cities with populations over 10,000 people will receive funding over a 17-year period. Per our localized agreement that was built off of that One Washington Agreement, the OAC has a very defined scope. So in our region, it's identified as a regional subcommittee that's required by the One Washington Agreement. In theory, we are to oversee allocation, distribution, expenditures according to approved purposes established in the One Washington Agreement. So essentially, are the funds being used in our region for activities that are covered under that One Washington Agreement? What this does not mean in our region is that we get any of the funds. The ASO does not get any of the opioid settlement funds. If a city, for example, were to decide they did not want the funds in our region, it would actually revert to their county of origin. So funds don't flow to us at all. But our role on the OAC is to ensure the funds are at least being used for the generalized purposes in the One Washington Agreement, which are very diverse. In theory, we would also be available to dispute resolution between local participating governments. It's hard to forecast what that might look like, but if a city were to accuse a county or a county were to accuse another county of some inappropriate use of funds, then we would be the body that would speak to it first. And then we have a responsibility for public accountability and transparency of the dollars utilized within our region. But what's being created right now is actually a statewide dashboard that will be utilizable by all cities and counties and then individuals in the community. If you had an interest in identifying what Snohomish County was using their funds for example, or if they've received their funds, all of that would be in the statewide dashboard, and you'd be able to go in and actually look up a little bit of information on spending plans, what programs have gotten funding, how much of the disbursements have actually come out, because that is not even going to schedule so far in the way that it was expected to. There are multiple bankruptcies at play, et cetera. So it's kind of a moving picture right now for sure. And that statewide dashboard is going to help create that transparency that would be helpful. We were considering building our own dashboard, but now that there's the statewide dashboard being developed, it wouldn't make as much sense. And it's probably useful to just have all of the information flowing there. In our region, the cities and counties can enter it themselves directly in the dashboard, or if they don't have the staffing to do it, we would be willing to do it for them. So that's what we've discussed in our region. It's currently under development, and I think they're hopeful that this statewide dashboard will go live in the next 2 to 3 months. I don't own that timeline though, so I do want to identify that I can't for sure confirm that the state will hit their timelines. This is a list of the approved purposes that each of the counties and cities can use these opioid dollars towards. But I would caution that within the One Washington Settlement Agreement, this is just like the headline. And then there's multiple bullets under that that describe it even more. But a very broad stroke across this agreement. The approved purposes for opioid settlement dollars include treating opioid use disorder, supporting people in treatment and recovery, connecting people who need help to the help they need, connections to care, address the needs of criminal justice involved persons, address the needs of pregnant or parenting women and their families, including babies with neonatal abstinence syndrome, prevent overprescribing and ensure appropriate prescribing and dispensing of opioids, prevent misuse of opioids, prevent overdose deaths and other harms. It can be used with first responders related to the opioid epidemic, so there just needs to be a tie there for why they think that the funds should be used for first responders. Leadership planning and coordination related to the opioid epidemic, training related to the epidemic, and research related to the opioid epidemic. This is a very broad list, and what I would say is I don't know of any county or city that's getting enough money that they'd be able to appropriately address every single item on this list. All of this would cost a lot of money. And so what I've seen our communities and counties needing to do is prioritize where they put the funding to have the most impact on the system. And that looks different depending on how much funding they're getting. So when you look at Snohomish County and what Snohomish County is able to roll out in this county versus San Juan County that's getting significantly less dollars, it's going to be very dramatically different what programs they're able to roll out. And that is the end of the OAC. So the OAC, where we stand right now is it is very new. We had our first meeting in December. We're trying to meet about every other month, but this process and progress is very slow because so much is still being identified. So when we started meeting, we started talking about a dashboard and if we could roll forward on a dashboard for a region, and then the state identified they were doing a dashboard. So then we didn't need to do that. So we're still trying to identify how to structure the meetings moving forward. In theory, this is a 17-year commitment and that we're working with the counties and the region and the cities to make sure that it's useful. And then we have an agenda that makes sense to what we're actually scoped to do. The other piece we're hopeful to see not only in the dashboard, but in our regional OAC is conversations about maybe what's working. Because I think a lot of us know or find out what's not working. And the moment we have like a success somewhere, we really need to shine light on it so others can determine if they can invest in that same space. Any questions?
I'm giving people to think of their chance. Randy.
Quick question before I head out. I know you had said part of this fund goes to the county, part goes to cities over 10,000, living in a small city. My question is, and I don't know if you would have the answer, but could the county appropriate then funds to go to smaller cities?
So they wouldn't, in my experience, the way that it's rolling out in Washington State is the communities with over 10,000 will get their own set aside funds. And essentially the county dollars that are going to the county, it's then incumbent upon the county to create various programs that meet these approved purposes that meet the whole county or cover the whole county as much as they can. So they wouldn't, in my understanding, pass money to smaller communities because the issue is it's not as much money as people I think it might be. And to make a program that will actually touch this population, if you break up that pie too much, it won't create any programs. So in theory, they're going to create interventions that are across the whole county.
Okay, thank you.
It sounds like then too, if we're going to be, if from a rural perspective, we're going to be effective, it's to make sure that we get ourselves and our perspective to the tables where the strategy is being developed on how to use the funds that are coming in. And make sure that amongst ourselves, we have created our own understanding of what it is that we want to advocate for at those tables. And I'm going to go ahead.
Those tables would be specific. It wouldn't be the OAC, which is the place to have that impact because we don't create the spending plans. It would be seen at your county or the city level if you're in a city that's that large, which the rural perspective, I'm guessing, would not have that many options. Maybe Monroe, I see Joe raising his hand. But I think that the city or county level is where you're going to have potentially more impact.
Sorry. Yeah, this is Joe. Just an observation I wanted to share. It's nice to have you with us, JanRose. I appreciate you. And since you're already adjacent or involved with the AOC, wanted to share something interesting that came up. So I'm on the Child Death Review Board for Snohomish County. And a couple of months ago, we were looking at youth overdose fatalities. And the one thing that really emerged was all but one of the youth who overdosed had naloxone in their pocket, and those on the periphery believe that that youth would be able to resuscitate themselves if they overdosed. So there's this gap in knowledge. Not only should you not use alone, but if you do, know that you can't resuscitate yourself. So thought that was interesting. That's all.
That is very
And I think educating the community that especially if fentanyl is the drug of choice, one use of naloxone is not enough. It's the naloxone and then immediately to a hospital that has to be. And I think that piece still gets lost today when you talk to people, even specialists sometimes
I agree.
aren't necessarily thinking in that way. And what I'm hearing from emergency responders is even sometimes when they're on track to go to the hospital, they're giving naloxone for people with fentanyl 3-4 times easily. Police are doing the same thing, and that's how much they have to give the medication to prevent an overdose prior to getting medical assistance.
Yeah, so I just bring it up because you have your sphere of influence, and I don't think this comes up often. I hadn't heard it before we actually investigated the overdose deaths, and so it was kind of a realization of that group that just having naloxone isn't sufficient, but we're not promoting that. There's a false sense of security in the community. So just going to point 8 on your slide here. So I'll step back.
No, that's a great call out. And one thing the ASO, as we look at our strategic plan, is considering, is there some realm of training we could make available? And I'll use one example where this came up. It's not related to opioids, but I was talking to someone in my personal life who called me because they were trying to help a friend navigate the youth and family system, and their friend who has insurance, has good insurance, had contacted 6 counselors to try to find a counselor for their child. In this situation, the child, and this is probably, everyone's heard stories like this, right? The child was not at a really elevated level of symptoms. The child was fairly stable. But one of the warning signs had been that they were starting to get into their parents' alcohol cabinet, and they were about 12 or 13. not with regularity, just enough that the parents were trying to do that prevention, right, that level. And the moment the alcohol cabinet was mentioned to these private counselors throughout Snohomish County, actually, all of the counselors said, nope, we can't work with them. We aren't specialists in substance use disorder. And when I tell you from a behavioral health perspective, maybe the child has a substance use disorder, but really that was just a symptom of the behavioral health anxieties and issues that that child was experiencing, right? So one of the things I coach my friend on is how to coach the family on how to talk to a counselor. And it's something as basic as that. From that conversation started this whole other conversation at the ASO that is there a body of trainings we should make available to the system, either virtually or in person? And we have that ability to meet some of these needs that are just, this is how you navigate the system. And I think we see that as an opportunity with the Youth Navigator program. But even on this one, I developed a whole training curriculum in King County, and it did not cost any additional dollars to King County to do that. It is possible to create training with very little resources.
Right.
And on that item, prevent overdose deaths and other harms, that feels like an easy point to say, hey, we've created a 30-minute training on some of the high level things that the community should know.
If you want to pilot, Monroe's a willing partner. Just saying.
No, I mean, it's a great idea. It's and I hadn't thought to put that one in there as well, because there's certain things that at this level you just end up, it's your everyday. The other thing to keep in mind with all the opioid related stuff is often in substance use, you see us go through a period of uppers, and then we go into the downers, then we go back into the uppers. And very early data, we've been in the downers for a while between heroin and fentanyl. And we're starting to see a little bit climb towards the uppers, like cocaine. But what we're seeing is it's laced with fentanyl now. And so it's a different drug than we had historically in Washington state. There's also work being done at the state level to try to understand why we see this continued drive up in behavioral health and substance use work. They have a 5-year committee that's supposed to be looking at some of the reasons for that. And I think we'll see a lot of it goes back to prevention, honestly, in youth before they get to the adult population. And it'll be interesting to see some of that come out.
Good questions and thoughts and insights. And I want to draw everyone's attention to David Fine put in the chat a family navigator training on June 10 through 13 speaks to this. I want to bring us back around to the idea that all of these things that are being talked about at different tables, no matter what funding it is, there is a rural custom perspective that we want to make sure to bring there. And that doesn't just mean that we expect whoever's at that table to know it. We have to coalesce what that is. And I'm grateful we have people like everyone that's here, JanRose, who perhaps understands even better how to connect some of the amorphous conversations we're having at this table to help, you know, make our points concise and deliverable and understandable, and perhaps come up with some interesting solutions on how to puzzle piece with work that's already going on in the more urban areas and at the tables where this funding sits right now. JanRose, I can't thank you enough for coming, giving such a comprehensive and insightful presentation. This has been very useful. I'm glad that we've recorded it because those who weren't here are going to be able to see it. Your dedication to enhancing not just behavioral health, but rural behavioral health is so commendable. And I'm looking forward to having you at this table going forward. If there are no other questions, I'll leave it open for another second. I'm going to move us on to talking about a very related topic, which is our community conversations on stigma events that are happening in June, the 26th and the 27th. I'm going to turn it over to Kari Bray, who helped us with creating, she didn't help us, she created, or she and her team created a communications plan. And I invited her here to give us an overview, to let you guys look at the poster, etc. If I were really good, I'd be sharing my screen and showing you the overview slide. There we go. And now the slide in your packet, of course, the link works. If you tried to click it on the screen, it's not going to work to go look at the comm plan. But I'm going to turn it over to Kari. Thank you so much for being here, Kari.
Thank you all for having me. Please pardon the croakiness. The allergies have been brutal this spring and I still sound a little froggy at times. So if my voice goes in and out, bear with me. Yeah, thank you all again for having me and for doing all the hard work, which is the actual planning of the events. So I get the easier part, which is just putting together a how do we tell people about the events plan. So I was thinking I would do kind of a quick overview of the plan. And then at the end of that, I actually have hot off the presses, like 10 minutes before this meeting. I got updated versions of the flyer and poster that have the QR code for registration and a little bit shorter text. So I will screen share those once I do a quick overview. Where we're at right now is we do have the communications plan more or less buttoned up with some placeholder pieces that we'll fill in as we go along. A registration form has been included for the event. We'll clearly communicate that registration is not required, but we wanted to have that as an option because one of the things people can indicate on that registration form is if they have any accessibility needs like language access, so that can be considered ahead of time. I have reached out to one of our staff who speaks Spanish fluently and can translate to ask for a Spanish version. So I'm waiting to receive the translated text back, but we do have that registration form in Spanish as well. I did want to note that we would only share the Spanish language flyers in communities where we know there will be Spanish interpretation available at the event. We would not want to promote an event in Spanish on the flyer and then have someone show up and not be able to understand the event. So I'll make sure that I stay in close touch with Lori and the group to confirm where we want to share the Spanish language flyers as well as the English, but we will make sure those are available. So we will have flyers and posters. The flyers, there are 3 versions, one for Darrington, one for Sky Valley, and one specifically for Train the Trainer. The idea is that those can go up in the applicable communities at key hubs. Lori has kindly offered, working with other folks on this group, to get those out into the communities. So we'll get those printed in the next couple of weeks so those can start going up. They can also be sent to partners so that anyone can print. The flyers are all just standard size paper, so anyone can print and post or forward along. And then the poster has all of the events in one, so that it's just one version of the big poster. We figure there will probably be fewer of those. Not everyone has space for a big poster, but that will have all 3 of the events. And then the Train the Trainer flyer can be brought to the event so that anyone coming to those Darrington and Sky Valley events can pick that up and hopefully come to Train the Trainer, and can also be shared by partners ahead of time. So there's a few versions of the flyer that I'll show you in just a bit, and those will be going out into the community soon. The other pieces that we're working on, we do have a draft news release that we just need to update with some links and some quotes once we get those. The idea is that we would send that news release out about June 12th or 13th. My previous life was as a newspaper reporter at the Everett Herald, so I can tell you that's about the sweet spot for having media interest with enough notice, but not so much notice that it's too much time and they don't want to write about it on that timeline. So we'll send it out right around the 12th or the 13th. And then myself and my amazing colleague, Jen Egger, will help with fielding media questions and response. We did clarify that media is welcome to attend the events because they're in public spaces and they're public events. So just for awareness, someone might show up to take notes or might show up with a camera. And because it's a public event, would be expected and frankly a good thing because it helps us get the word about addressing stigma in these communities out to a broader audience. So I did want folks to be aware that there may be media that come to the events. Any questions in advance of the event or after the event that come in from media, myself or Jen will help field those and connect that to the appropriate person, whether it's Lori or Tedra or our health officer, whoever would be the appropriate person to help answer those questions. So that news release would go out shortly before the event. And then we're also planning to do social media promotion. We would do those through the overdose prevention channels, which is what the MAT group uses. And then those can be shared through health department, county, other partners. Our idea for those is that we would have some quotes about the importance of this work coming from local voices. So it would be a mix of some leaders, but also hopefully some voices in the community. And then that would help highlight the event. So we would have a series of posts rolling out where it's not just us saying, hey, there's an event. It's someone who's hopefully a recognized name or face in the community saying, this is why this matters. I hope to see you there. And so that series of posts would roll out in June to start promoting the event leading up to it. And then I am working on identifying someone who may be able to attend and record one of the sessions. I will actually be out on vacation at that time, but I'm working to get someone identified who can record one of those so that we have it recorded as well. Where we're at in terms of next steps will be making sure that this group right here feels pretty good about those posters and flyers and that we're in a good spot for those so that we can get them printed and start getting them out in the community. And then working to identify folks to get quotes and start gathering those quotes. Some of them will be used in the press release and then others will just be in the social media. If we get a dozen quotes, that's just too many for a news release, but we do want to make sure that we're featuring community voices when we promote this event. So with that, I'm going to attempt to share my screen to show you the updated versions of the flyer and poster. And then I am happy to take questions and take some notes on feedback. So let me find my share screen button here.
And while she's doing that, I want to encourage folks, look closely. If you have feedback, now is the time to give it. We want to be able to have time to incorporate anybody's insight and to get them printed and get them out to you both in electronic and paper form so that we can start raising the profile. So it's really important we get your feedback at this stage.
So hopefully folks are seeing something that looks like it might be a flyer for this event. Is that okay? I see some nods. Wonderful. So this is the first flyer. This one is for the Darrington community event. If you're wondering where in the world these images came from, huge thank you to Snohomish County tourism folks. They have a media library with actual local photos that you can search by location. So our graphic designer pulled photos that were in the Tourism Bureau's mix for those communities. I can't say where the spot is specifically, but hopefully it'll be relatable to the community because it's from the community. So this is what we have for the Darrington flyer, the nice image, the event information. We did pare down this paragraph. If you see the one in the current communications plan, this has been shortened a little bit so that we could up the font size a smidge and it'd be quicker read. And then we've also added this QR code. I'll admit this just came in right before the meeting. I have not tested the QR code. I will do that and we will replace it if it doesn't work. So here's where we're at with this one.
Can we talk a little bit about the QR code? So when people register, we are saying on this poster that we're both going to offer refreshments and that transportation is available. But when they register is when we're going to actually know who's requesting transportation. I mean, it will be nice to know how many for refreshments, but we'll be able to cover that. It's the transportation piece that I want to talk about as soon as Kari's made her presentation, because we say that we're going to offer it, but I don't have a really robust or any plan for that at the moment.
Yes, thank you. And I would guess, just a hunch, the biggest need may be for folks who are in Darrington or out in Sky Valley who want to get to Everett for the Train the Trainer. I would suspect that may be the biggest transportation need. Just a hunch, but we'll see. So that's our first flyer. I'll take comments at the end. We can go through one by one, but I just want to make sure folks see all of them. Switch over to Sky Valley, very similar layout. We just changed up the wording and not the wording, but the location and time and everything and the image. But really overall the same. You'll see the only difference is the logo. We don't have Snow Isle here since this one isn't at the library, though we did include the Snow Isle logo for the Darrington event since it's located at the library. This is our Train the Trainer. So we went with a training photo for that one. And it's a little different because it's more about what is this and trying to make sure people know that they do need to attend one of the community conversations before attending the Train the Trainer. And then the last one, forgive me here while I move this so I can open it. There we go. So this is the poster. It probably looks really small on the screen. Here's the full view. I'll zoom in so you can get a little closer look. But this is highlighting all of the events all in one fell swoop. And then here's a little closer view so you can see how that plays out. And the idea is that with the poster, people can hopefully quickly identify which one applies to them in these boxes. And then it has the consistent information about the events.
I wonder, are we looking at the poster right now? Or
yeah, I don't think it's showing. Oh dear, I opened it in a new tab somehow.
But it sounds really good, Kari.
I can fix that probably. Here, we're gonna do I'm gonna stop sharing and reshare because what I did is open it in a new tab and it got mad at me. So I'll just share that tab instead. Let's see, which one is my poster? Thank you for bearing with me. Technology is a joy.
Well, we just
Yeah.
appreciate all the work.
Well, that one is still trying to open in a different tab. I'm going to reopen it real quick because I think that will be easier.
I know these have the posters that we've been through or have some updated language. We'll try to get that updated language, a link to that out to folks so that you guys can look at it. And we're going to set a deadline, I would say by the end of day tomorrow, for any feedback you would like to give about the posters. Okay, sorry, go ahead. We see the poster now.
You see it now. Wonderful. Thank you. I just had to reopen it so it would cooperate. So here's the full view from a distance. These are designed to be 11 by 17, so standard size poster. And then when you actually zoom in now, let me make sure I don't go too crazy. You can see it a little bit closer. Again, the idea is that people can pretty quickly see their area and say, oh, I'm Darrington or I'm Sky Valley, or what's the train? The trainer. And then below is emphasizing free and open to the public. It has the same QR code. We are using the same registration form for all of them because it's a lot simpler than having a whole variety of registration forms. That gets confusing. And then down at the bottom is just the disclaimer that's part of the funding source, the HRSA funding source. So that's kind of the quote fine print to make sure we're acknowledging the funder. So with that, I will switch back, start at the beginning here with the Darrington one. I'm curious if folks have any specific feedback, questions, things they can't see.
Kari, this is minutia on both the first two flyers. When you go down to the train the trainer paragraph, so scroll down right there. That little paragraph there is left aligned, and there's an extra space in front of the L.
Perfect.
That's all. Minutia.
Boy, are we grateful Joe's on this call.
Beautiful.
Does everybody feel good about the languaging? Good, okay. We're trying
One thing, sorry, really quick, I did try and scan that code. I'm not sure if it's just because it's like through screen, but it did say that something went wrong and there's technical difficulties. So
You're gonna fix that.
I know you said you haven't even tried to mess with those yet, but I tried to do it through here and I just had to like really zoom in.
And I know the link, I think there was an error with the link a little while ago, and then it was working on my device. Like my county computer. I'm wondering if it's a permissions thing. We may have to just update the form so it's public because it seems to be working on county computers right now, but maybe it's not working on phones because of that. I'll check on that. So I'm going to make a note now.
Great.
Check form permissions.
So when we get into that form, oh, David, please go ahead.
Really briefly, and this is not about the flyers, the posters, which look great as always, Kari, but more for the registration for DEM, because we do have a somewhat limited parking situation. For wherever that registers to, it'd probably be good to give some people some information or follow up with that list for information on where to park. And then also giving us just a head count, because I know that room supports 40 easily, and then if it's more than that, we might have to look at some of the other options we have here, but just kind of looking forward to when we actually get better numbers for stuff.
No, David, that's a really good point. And who should we connect with to find out about what parking is the right parking?
Yeah, so I can give you, I'll work with the training coordinator about how they explain to people where to park. We just want to make sure people are parking inside the gates and they're not parking in the parking for the business. They have not, I think they have gone to a work from home structure, so that what was once a major issue is no longer, but still want to be respectful of their parking spots. So
thank you. Okay, sorry, Kari, go ahead.
No, that is good feedback. And I did give the PIO at DEM a heads up. If we do hear from, an excessive number of audience members, or if we hear from any media members who say, can I go to train the trainer? We will make sure that they're aware of that because it is a smaller setup than some of the other community venues. And the registration form does ask for email, I believe. So the idea is that an email could go out like a week ahead of the event saying, hey, here's what to know. So I think that would be a great way to share parking information.
I want to acknowledge we're right up at 12 o'clock and I really only
Yeah.
have you guys reserved for an hour.
Let me free folks up.
No, thank you so much, Kari. This was very helpful. I'm going to work with Kari to get these updated posters set up at a link somewhere that I will send to folks. And I will say to you and everybody else who's on the list, we look forward to having your feedback by the end of the day on Friday, and then we're going to move forward. I know that we need to talk about transportation and food planning, and maybe what I'll try to do is reach out to people in smaller groups to do that. And just quickly slipping through, you'll notice there are about 12 different times in the slides today where I've shown what the different times are for our different community events. What I want to underscore is we can raise all the profile that we want, but if we, the people who sit at this table, are not making ourselves a model of prioritizing the fact that we go to these events and actually engage in the conversation, then we've missed an opportunity. And I hope that we're all going to take that opportunity to get to at least one of the community conversations events, and maybe even to the train the trainer, because it will be valuable to have a cadre of folks trained up to do this in each of our communities. Tracy Frank is here. I'm just so excited that Tracy and the group there in Darrington is doing some training, and I'm going to let her talk about it.
Yes, sorry, my camera is, it's making my, it's been freezing. And so then I get this really, it freezes right at the worst time. And so I've just had it off today. Yes, we're excited. On June 10th, we will be doing, training for our students that want to attend, and community members for, oh my gosh, my brain just went.
Naloxone.
Yes, naloxone training. So flyers should be going out today regarding that training that will take place at our high school.
And the reason I'm really excited about this is a school that's doing some training and making it available. And I'm excited that Darrington is leading the charge on that. And I'm hoping that in more of our rural communities, we might be able to do the same. I know we have some areas, I don't know if it's in Snohomish County, but where in their grad bags, the folks who have attended a training, and they also have a video for training, in the grad bags that are sort of, yay, you're graduating, they do include, I think it's the school-based health centers who are including some naloxone and an overview of how to administer it for each of their graduating seniors. So I'm not saying we'll get there this year, but maybe in future years we might get there. Just put that out there. And you'll see in your package there is a sequential intercept model overview, which is something that we've heard that the that the MAC group is going to be using to anchor the work that they plan and do with opioid settlement funds. And so I think it would be great for the folks at this table to start thinking about, at those different interception points, what is it we'd like to see happen in our communities, and make sure we get that represented at the tables where those strategies are happening. Moving along, next steps. I think that's everything. We're not going to see you next month here on Zoom, but I hope to see every one of you in an actual community conversation, maybe at the Train the Trainer. Our next meeting together in this forum is going to be on July 25th at 11 a.m. I invite you all to contact me if you need anything and let you go to lunch. I appreciate this hour of your time. Please email with questions, and I'll stay on if there are any questions or conversations folks want to have. Thank you. Goodbye.
Thanks, Laurie.